Hello, welcome to Tara Talkies. This is Tara Sahuta. I'm here to help you out with your Celban exam. Today we are going to discuss about the writing task, as a beautiful person has already requested me to upload something on writing. So as I promised, I'm here and I will be telling you in detail what is the expectation in your writing task 1 and task 2, how well you can prepare for it, and of course, and how you can score well. And definitely during this whole episode, I will be telling you in details what Celban like how they want you to basically do this exam, what are basically they looking and what they're testing in the writing test. It's not hard, it's not difficult. The only thing is that you need to prepare it well, you need to be organized, you need to know what you basically have to do. It's just not the random things you're going to go and write there, because that will not be helpful. Okay, so keep watching this whole video, and I believe this will be a great help. And of course, if you really want me to do something else and you want some more content on writing, you can leave the comments in the comment section. Like, share, and subscribe. Thank you very much, and keep watching this video. There is a lot more here, okay? Thank you. Okay, so those who are preparing for a Celban test, I believe, of course, you know what Celban stands for, which is Canadian English Language Benchmark Assessment for Nurses. So let's learn something more about it. Well, so Celban is designed to test the English language for internationally educated nurses. It assesses the language abilities in 4 areas, which is reading, listening, speaking, and writing. And scores required by all nursing regulators include the CLB scoring. So CLB is the Canadian Language Benchmark. So reading section requires 8 CLB, listening requires you to have CLB 10, which is the highest among all. Speaking requires CLB 8, and writing requires CLB 7. Now, Celban test consists of 2 parts. The speaking assessment is conducted as 20 to 30 minutes session, and listening, writing, reading assessment conducted as 3-hour group test. But today in this episode, I'm basically going to focus on Celban writing part of the test. So Celban writing part is something which you can prepare on your own, and if you prepare it well, definitely you will be able to score well in your exam. So Celban test created based on skills which nurses require on daily basis, like describing patients' physical and emotional characteristics, to describe an event that happened in the past, or explaining the diagnosis, and every day's discussion with the nurses. So there is a lot that we need to use the writing skill. Every day you are writing nurses' reports, patients' nursing diagnoses have been made, assessments have been written off, there are like incident reports that nurses are writing. So it's a lot of communication through writing that nurses have to do. So it is very important that you do well in your writing session as well, because if you're scoring less than 7, you will not be able to pass your Celban. So there are 2 tasks in this exam, and the total Celban writing would consist of 45 minutes. So both tasks require you to use complete sentences in the paragraph form. However, the first task in narrative description and the second task is an opinion piece. So the thing here which you need to take care of is that you need to use complete sentences. Make sure that you do not make mistakes, that your sentences are correct. And the first task is the narrative task. So basically, something has already happened and you are narrating the incidents, like the patient fall, or the patient has slipped in the bathroom, or something else has happened. So you are basically narrating a scenario or narrating an incident which might have happened in the recent past, right? And the second task is an opinion piece. So that means they're going to provide you some information and you would have to provide your opinion on that. Okay? All right. So how to express an opinion in writing? So read a statement about a health related topic. So they are never going to give you anything out of your field, which is definitely nursing or health sciences. So I would say stay well versed with all the social topics in your country, all the things which are going on right now, like coronavirus is there. So there could be prevention of infection. There could be people who are drug addicts. So there is need to, be taking care of them. So what measures are being taken by the government? What is the nurse's role in that? So such kind of topics, they are health related topics. They could be social topics. They could be social health issues, which they can bring in the writing test. And the second is describe your agreement or disagreement with the statement. So of course, they're giving you some statement, they're asking for the opinion. So it could be demanding an agreement or disagreement. So either you can agree with it or either you can disagree with it. So you have to definitely place your opinion there. Or else explain your position and provide examples and support. And to do all these things, the tools that you require in writing, like your pencils, erasers, they are going to provide there. So you wouldn't have to carry that stuff with you. Now, all the topics are going to be, which is going to be used in your everyday nursing activities, all your nursing skills, whatever information you might have used in your nursing practice, your clinical care, nursing education, and whatever the conversation in between the nursing staff, your training, and as caregiver, what are your responsibilities? So all the topics of writing are going to revolve around nursing only. So you don't have to be afraid of what you're going to get in writing. So most of the topics are going to be familiar to you. So that is why it is important that you practice the baseline, the layout of writing, and that will help you, to pass this writing test. Now let's see how we can write an incident report, and I'm sure that those of you or all of you, you have already passed your nursing back home in your countries, and definitely you might have practiced writing incident reports. So we just have to make ourselves, remind of all those things that you might have practiced, the incidents that might have taken place there, or whatever exercises if you didn't practice as a nurse or you just came after studying nursing. So remember everything that you might have done in your nursing career or in your nursing education. So it's not something out of the blue which is going to come here. All that you have to remember is things are happening when they have happened, who was involved in that, what has happened, where the things are happening, why the things happened, and how the things happened. So make sure that you are answering all these questions. So when you're writing that incident report, your paragraph, your sentences are going to answer all these W's. So who, what, where, why, and how. So when you have answers to all of these, so you know that you are going in a right track. Now, other few things that you need to be careful of is that your words, your sentences, and whatever you're trying to say, it should be clear, it should be concise, and it should be accurate. Do not confuse the reader. Do not confuse the examiner. Do not try to give, excessive of explanations. Make sure that your information is concise and your information is accurate. Do not give vague information. It is very important for you to make sure that you're using correct grammar, you're using correct punctuation and spelling. This is your language test. As I told you earlier as well in my previous episode, that they are not testing your nursing knowledge, but yes, grammar, punctuation, and spelling, all of them are very important. So make sure that you are not making mistakes in terms of spelling, punctuation, and grammar. I would say it will benefit you if you can like make a list of some, really complicated words in nursing, like geriatric, pediatrics, or all those kind of words which you think that you might make mistakes when you're writing them down. So try to make, a list of all those kind of hard words so that you do not make mistakes when you're going to write them in the exam. All right, so this is how your paper is going to look like. If you're making mistakes, it's going to be all, covered with the red ink, and that's what we don't want. So make sure that you practice it well. And state the facts objectively and avoid making assumptions or casting blame. Write this like the patient who is on complete bed rest and on sedatives was trying to walk around the hall. The patient was not being assisted by any family member or nursing aide. Rather than writing it like the patient was walking in the hall and when he was supposed to be taking rest or either assisted by someone. So here what you're doing is you are blaming the patient. So the patient was walking in the hall when he was supposed to be taking rest or either assisted by someone. So this is kind of a blame game, and that's what we don't want to do. So we have to give a concise, accurate information. So the patient was not being assisted by any family member or nursing aide because that patient required to be assisted because that patient could not walk by himself because he was on sedative. So definitely he is not well aware of the surroundings and he does not have that balance to walk. So he should not be walking by himself. But that doesn't mean that we are like showing that blame on the patient. Okay. And also provide a chronological sequence of events. So chronological sequence means we go in order of time. So chrono means time and stories are told chronologically. So if the patient had a fall, so you need to explain things chronologically, right? So who saw the patient, like how, in what position the patient was found? The patient was found on the floor, the patient was seen by who, and what was the situation of the patient, what was done after, who did you call, the doctor was called, or a patient's family member was called, or before that, patient's vital signs were taken, we checked patient's blood pressure, we assessed the patient's pain on the pain scale, and patient was stabilized, and then doctor arrived, and what treatment doctor has given, and what workout whatever things have been ordered or prescribed by the doctor. So likewise, a boy meets a girl, boy falls in love, and then they get married. You are not going to start it with them getting married first and meeting them, right? So we need to follow a chronological order. All right. Now let's have a look at of this example. So this is the incident report in the chart form. So that's how you're going to see something in the exam too. And I'm definitely sure that you all have seen the incident reports. You know that this is the kind of data that you will be given, and you know this, right? So there will be the name of the patient given to you, time of the incident will be given, location, type of the incident, witness, nature of the injury, contributing factors, vital signs, mental state after the incident, physical status, persons notified, treatment ordered, and the x-ray. So in incident report, basically they have provided you everything. You have all this information. You just have to put this in the paragraph, in sentences, and in a chronological order. So make sure, and you can use your own date and time, which will be given in the exam. And you have the series of the incidents. You know what is the name of the patient, what is the time of the incident, and where the incident happened, what happened, who saw the patient, and what is the nature of the injury. Client had bruises, swelling, possible hip injury, medication. Contributing factors could be medication, railing, because client could be on a sedative medication, so that might have led to kind of that stage where client could not balance him. Railing was down, so client was trying to get off the bed, nobody was around, his railing was down, and definitely that has led to patient's fall. Now, after that, you might have definitely examined the client. You might have assessed the patient. So you check the blood pressure, respiration, pulse, 75 beats per minute. Now we have to check the mental state of the patient after the incident. So his mental status right now is confused, and patient physically is not able to stand, complain of pain. And then who were notified about that incident? Of course, after doing the assessment only you will go and notify, right? Or else you are the person and you might have told your fellow nurse, or you might have told the RPN to go and inform the nurse, right? So there can be various possibilities. So doctor was informed, nurse manager is informed, and the next kin to the patient is informed in those situations. So you have to mention all that. Then what was the treatment ordered by the doctor? So doctor prescribed extra strength Tylenol. He also prescribed ice pack, and he ordered some x-rays. So this is all we have to do in the incident report.
Okay, so thank you very much for watching this far. Thank you for watching the whole episode. I hope that this would be a great help in your preparation. And of course, you have to play the major role. You have to spend your time. It's important to practice. Whenever we are preparing for any language exam, whether it's IELTS or Celban, the more you exercise, the more you practice, the more better outcome it's going to be. So keep practicing, and all the best for all of you, those who are preparing for their Celban exam. And keep watching Tara Talkies. So goodbye for now, and I will see you in my next episode. Thank you very much, and do not forget to like, share, comment, and subscribe. Thank you. Bye bye.